Hello and welcome. It's episode number 24 of the Hilarious Humanitarians podcast. I am Frances Echeverria, licensed marriage and family therapist.
Hello, guys. I am Deanna Silverman, licensed clinical social worker.
So we're going to jump in today, first of all, with a disclaimer. We are not a replacement for professional help. And this is going to be really important because of the topic today. So if you do need referrals and things like that, you know, you can always get in touch with us and we can help give you some guidance or in the right direction the best that we can.
And if you can't reach us for, I might be changing a diaper, I might have fallen asleep standing up, I always refer people to 211.org. It's a website that you can you type in your zip code. Also, we're not sponsored by them in any way.
Yeah.
This is just literally a referral I give to everybody. You can also call 211 from any phone, I believe, for free.
So these are places you can go if it's an emergency.
Yeah, and it'll pull up an entire list of resources, anything under the sun, and then if you type in your zip code, it shows you the closest resource to you. Then obviously we're obligated to say that if you're ever in a mental health emergency, always just call 911.
And the reason why we're doing this specifically to bring it up is that today we're going to talk about when you diagnose yourself
or others.
In the world of Google and WebMD and everybody being a absolute professional on every topic they think they know anything about, this is one of my biggest pet peeves, is when people diagnose themselves and throw these things about, Deanna, in a way where it's used the wrong way, often to justify poor behavior, and then it just perpetuates these stigmas that are associated with mental health issues.
It's funny you say that because I have a very similar pet peeve, if you will, when people will insult other people. Let's say somebody's just being particularly sensitive, or they're in a mood, they're bitchy, they're being bitchy. Instead of just being you're acting a little bitchy, stop it. They'll say things like, you are so bipolar. And it's well, way to go, guys. Way to go with, perpetuating the stigma of mental health. First of all, anyhow, it's a pet peeve of mine. Please don't do that.
Yeah, so what we're going to do today is one of the things to become licensed, which both Deanna and I are as mental health professionals in the state of California, is that we have to learn this thing called the DSM, which is the diagnostic criteria for mental health issues, if you will. And we spend a lot of time having to know it, and even then we have to look things up and receive consultation from people. It is a big part of licensure, of studying, of staying on top of your trade once you are licensed. And so basically what we're doing here in our podcast today is clearing up some of these personal misdiagnosis, also the use of things in a way that doesn't help anybody, including yourself if you're using it to justify behaviors. And I'm sitting here with my diagnostic manual in hand.
We got to brush up, Because, it's interesting, we are licensed, and correct me if I'm wrong, Frances, in the state of California where you and I both live and practice, now that we're licensed and we've gone through all this clinical training and passed our board exams, we have the ability to clinically diagnose people. But it's such a sensitive topic that, and you got to be real careful, And so even if we have the ability to do so, oftentimes we're in positions where we don't, in a job. So for example, when I was in the psych hospital, there's an attending psychiatrist. So even though I have the ability to diagnose, I don't,
right?
At least in the capacity of that particular job.
Right. And that's how it is where I'm at too, because I work in a private practice where the vast majority of everyone here sees the psychiatrist.
Mm-hmm.
So one thing I want to bring up is people might be like, well, why do you even diagnose? Because I actually had this conversation with a client yesterday. Being able to diagnose is important for a couple of reasons. One, insurance companies pay out coverage based on diagnosis. Sometimes you cannot get insurance coverage or use your insurance benefits unless you have a diagnosable covered issue. So that's something that in mental health is kind of, it's a little different. The other thing is that in order to provide good treatment, it's good to have an idea of what you're working with so that you're not kind of like flailing around in the dark. And so research is done on particular disorders and diagnoses and things to provide the best standard of care. So categorizing isn't to make people feel impersonal, but it helps out, one, just from a financial aspect and coverage with insurance, but also to help people go in the right direction, right? So if you're coming to me with depression and I'm treating you for, gosh, I don't know, pulling your hair out, that might not be the same thing, right? So just want to put that out there, and the reason why labels are in some cases important. So you brought up bipolar. What has been your experience with people throwing that word around?
Oftentimes, like I said, I will hear people say things like, you're being a bitch. You're so bipolar. You change your mind all the time. God, I thought you said you wanted a cheeseburger. Now you want a quesadilla. You're so bipolar. Or you'll hear people like insult one another, God, have you ever been in a relationship where your significant other is calling you bipolar because of whatever? And that just drives me absolutely bananas. Like, first off, bipolar disorder, we let's break it down. Okay. So bipolar disorder actually there's bipolar 1 and then there's bipolar 2, right? And this is how I remember it when I was studying my licensing. Bipolar 1 disorder, you see a symptom of at least 1 week of what we call like a manic episode. That's at least 7 consecutive days. So it has to be consecutive. And the symptoms in bipolar 1 disorder, when somebody's having like a manic episode, and typically, correct me if I'm wrong, because, I need to brush up. I quit my job a few months ago, and Lord knows when you're out of it a little bit, you need to brush up, right? We always have to remain vigilant about what information we have and what information we're talking about. But bipolar 1 disorder is typically marked with like 1 week of mania. This is like pressured speech, super hyper behavior, very, very risky behavior. These people, if they are going to school or work or they have a job, when somebody who has bipolar 1 and is
actively manic, they cannot function. These people don't show up to work. These people don't go to school. These are the people that oftentimes you'll hear like will disappear. I remember hearing one case where this like mom of 4, PTA mom, yada, 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 living in, a different state other than Nevada, like got in her car, went to Las Vegas, gambled all their money. Like oftentimes you'll see this like manic, hyper spending, like people will blow their savings in like a day. Oftentimes they engage in like super risky sexual behaviors. So somebody who's being moody is not manic.
And with bipolar 2 disorder, instead of the 7 days, it's usually like 4 days. And usually the symptoms are just less
severe.
Extreme.
In fact, it falls under hypomanic. Those actually are like really kind of positive traits. To be perfectly honest, they're the traits that your employer might like because you don't need as much sleep. You're pretty like intensely focused on something. You're getting things done. And sometimes you can feel like you're on top of the world, because that's another one of the feelings, is this increased self-esteem and grandiosity. So it doesn't really raise any flags.
Right. And I mean, people will say that, if they have a job or they're going to school, they're still able to go, and your peers or colleagues may notice a difference in your personality or what's going on, but it's not anything to like, where you're like spending all your savings, right, and you're ripping your clothes off and you're throwing all your items out on the street because
you're way up.
Yeah, exactly. So, and have you seen this, like in the psych hospital, oftentimes people with bipolar enjoy the mania because it gives them energy and they feel, like you said, on top of the world. And so oftentimes they are medication, there's non-compliance. They don't want to take their meds because, quite frankly, some of them like the mania.
Well, and to be perfectly honest, unless there was like a consequence that included losing all of your money or having indiscriminate sex that led to relationships being ruined or STDs or unwanted pregnancy, mania feels, for the most part, can feel good. It's that spike. Now, the thing is, and we want to bring this up because, again, to go back, because somebody's being moody or is mad at you or angry does not mean they are bipolar. And I feel like the way that I like to do this podcast, Deanna, is if we can just educate people and then those people educate people. And then it just goes from there. We start to realize that you're really being not just insensitive, but ignorant if you continue to use these things in a way that are wrong. So with bipolar, I've seen this. There's also increased drug use and just risky behavior that can happen, stimulants and stuff. The other part of bipolar is the crash that includes depression. And so you might hear this sometimes where people say like they're manic depressive but bipolar includes the high and it includes the low of depression. And it can be debilitating. I've seen it where people have had to move back home because they can't hold down a job. I've seen where bipolar has caused relationships to end. It is something that requires for many people some sort of intervention with mental health services and also sometimes with medication and plenty of self-care. So again, going back to that situation where maybe you overheard somebody go, "Oh, I just flew off the handle. I'm mad. I'm bipolar." No, stop it. You're being a fucking asshole. That's the difference.
Yeah, exactly. Or you're like me, I'm PMSing and I'm moody.
Right. So that happens.
Yeah.
That happens. But the part of, and this kind of goes in, so we've covered bipolar. Going into depression, we hear that a lot, right? Like, I'm depressed.
Mm-hmm.
Depression actually has a set of criteria as well. And there are, I don't know the numbers in front of me, there are a lot of people walking around depressed, which is sad. Because there are things that can be successful in getting treatment and both medically related, therapy related, and choices that you make in your life so that you can set yourself up to feel better. But major depression and those kind of episodes, they include at least 2 weeks of feeling this kind of mood, loss of interest, also the depressed mood most of the day. What's interesting is that depression can either sometimes cause you to sleep too much or not at all. And it can sometimes cause you to lose your appetite or eat everything.
Right. In fact, when I think about depression and diagnosing depression, just as you said, it's marked by that, like, you need 2 weeks of symptomology. And then also look at like biological changes. So it's biological when we're looking at the human, it's like the eating, the sleeping, the energy. Feeling coordinated sometimes. You can feel kind of just a little off in that way, and inability to concentrate. Right. And then there's the unspecified depressive disorders, which are less extreme symptoms of, let's say, major depression. And then there's the persistent depressive disorder, which is just as it sounds. It's persistent and it can last for a while.
Right. And sometimes, and this is what's important, and if you're seeing a doctor, I would recommend this, there are tests that are available. Not all doctors do them, but there are tests available that can actually test for the levels of your neurotransmitters, because sometimes these are caused by biological things that are going on. Again, we're not doctors, but we're just saying that those tests and things are out there so that you can try and get the best help possible. Because just like many things we talk about, depression can run in families. Mm-hmm. I know that it's something that is run through both sides of my family, and that I didn't actually get help with until in my 20s. And looking back, I was like, oh my gosh, I was such a depressed child. I had no idea. With the depression thing too, this is where suicide ideation comes up. And sometimes people think they're not, it's not too bad because I'm not thinking about killing myself. That is really important to pay attention to, and to take those thoughts seriously in terms of, if you're having them, please ask somebody. Mm-hmm. Please talk to somebody. I had a really eye-opening experience this last week where a friend of mine had mentioned that they had this period of time where they were having suicidal thoughts. and it was very, very unlike him. And come to find out, it was a medication that he was on, because sometimes that stuff can happen. It's very rare, but it can happen. So if you're having those thoughts, just because you're feeling or thinking about, man, it'd be better if I wasn't here, or those kind of things, that doesn't mean you're going to get locked up in a 5150. I think sometimes people freak out that if they think, or if they tell anybody about feeling suicidal or just helpless, that, oh my God, they're going to come take them away to the loony bin. That's not how that works.
Mm-hmm.
So that is something, though, that does come up with both depression and subsequently bipolar, is that suicide ideation. So lots of resources for that. Lots and lots of resources. Deanna, we're moving through these, kind of addressing some of the pet peeves and the way people sometimes attach labels to themselves. Have you ever had somebody tell you like, oh, it's just my ADHD or my ADD?
Right. Or people just talking about ADD as if everyone has ADD. Did you watch that documentary, Take Your Pills?
Mm-mm.
There's, I think, Netflix. Let me see. Take Your Pills. I think that's what it's called. I just watched a documentary on Netflix. Yeah, Take Your Pills. And it came out in 2018, this year. And it talks about Adderall, prescription stimulants, and the defining drugs of this generation, and attention deficit disorder. And this guy was talking about in the documentary, and I thought it was really, really interesting. He's like, our society with social media and how everything needs to be like instant gratification. We're just getting like images and messages like boom, 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 boom. Like, oh, like it's like an assault of like stimulus,
yes,
like to our senses. And we want it everything now, 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 now. And it seems like it's like an act of God trying to get somebody to sit down and read an article that's 5 paragraphs long,
Absolutely.
like, oh my God, no, I can't concentrate. And he's like, we need to be really careful about everybody thinking that they've got ADD or ADHD, and they've got this like diagnosable like attention deficit disorder. Maybe you do, and you definitely need to seek support and evaluation if you do think you need the support or medication. But also we need to look at our society and how everything has been set up, where it's like,
where it feeds into it.
Where it feeds into it. And like, we're not giving ourselves the space to be present. We're always on to the next thing.
I think a great way to think about it. Do you remember dial-up?
Yeah. With AOL?
Yes. So back in the day, for the youngins listening, there's this thing called dial-up, and you had to listen. You had to wait for it. And it was all like, and you were so excited to get on the internet. We now have phones we carry around with access to the internet on basically almost anywhere. And we get mad if it takes any amount of time for a page to load.
Yeah.
You used to need to be plugged into a wall, into a desktop. I mean, it wasn't even a laptop, and you had to be plugged into. So we have.
Remember, like, it was plugged into the phone jack.
Oh, yeah.
So you would have to like ask your whole family, like, I want to go online. So does anyone need to make a phone call? Because when you're set up to AOL or like through the phone jack, like no one could reach you, because if you were online, then your phone was busy.
Yeah. And by the way, those are called landlines. Those are those really old phones that are in houses. So, but I think that's a great example of how we've just gotten impatient. And that doesn't necessarily mean we have ADHD. It means we've just gotten impatient. If you think about it as a muscle, like when you were a kid, when I was a kid, I could do the monkey bars so easy, right? Could you remember just climbing everywhere and doing all that when you were a kid?
Oh, yeah. Yeah.
Have you tried doing it in your 30s?
Nope, because I have a shoulder injury.
It's hard.
But
it's hard.
I've got a wonky shoulder.
Well, I don't, and it's hard. So I bring it up because it's a great analogy for our ability to be patient and wait. Instead, we jump on board with this, oh, I have ADHD, but by the way, ADD, attention deficit disorder, it's now technically ADHD, attention deficit hyperactive disorder. So that's where you'll see that thrown around. But this is a real thing with a real list of things, just like we said, like symptoms you have to meet.
Also, I want to bring up like a personal story in terms of attention deficit disorder or I said it
ADHD.
wrong.
Yeah. No, see, we do it ourselves.
So in terms of attention deficit hyperactivity disorder, I do want to briefly talk about how it hurts the people who are genuinely diagnosed with this disorder when everybody likes to say that they too have this disorder out of sheer ignorance, or, let's address the elephant in the room. Like there's a misuse of Adderall, especially like in the college and school environments. And this documentary does a really good job focused on how in American culture, everything is like so fast and everyone needs to be the best and you need to keep up or you're weak and you need to get out of, and so it breeds this environment where it's like, go, 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 go. And Adderall can help people to pull all-nighters and be super creative or whatever it is, and be really, really focused.
Which is superhuman, by the way. And
Which is superhuman, and you crash and you need to take care of your body. And there's cardiovascular risks when you take Adderall. There could be cardiovascular risks.
There's also a potential risk for addiction. And I've seen that happen where it starts out as, I really need to just focus for a test. And then newsflash, those medications are stimulants. You know what's also a stimulant if you go down that road? Meth.
Right. And they talk about that too in that documentary. But
so what's your experience with it?
And in terms of like the diagnosing, I just want to say, if somebody were to be in my studies, we talked about like, you must be diagnosed by 12 years old for attention deficit hyperactivity disorder in childhood. And you have to be ruling out like a specific learning disorder first.
Meaning they're having issues at school because they just don't understand it or process it. Yeah.
And if I'm not misquoting this information, I think attention deficit hyperactivity disorder also has to be present in it needs to be present in like two settings.
Right.
So if it's a child, they probably don't have it if so here's a good example. Like they're perfect, quote unquote, angels at home, calm, collected, they can focus, blah, blah, blah. They go to school and they're off the rails and they can't focus. They probably wouldn't meet criteria for attention deficit hyperactivity disorder because the diagnosis says they need to be exhibiting the same behaviors both in the home and in school.
Right. Which I've pointed out to clients when they try and self-diagnose. Your social life's fine. Your home life's fine. Oh, you don't like it when you go to work. Well, maybe that has something to do with what's going on at work.
Right. Exactly.
The other thing I wanted to throw out too is that you have to be careful in attaching this to children, because guess what? 3-year-olds have the attention span of a 3-year-old. 6-year-olds are going to school because they're learning how to stand in line and listen to the teacher. If they're a little goofy and running around and don't listen, that doesn't mean all of a sudden there's something wrong with them. It means they're a child.
Right. Let them be a child.
And part of our responsibility is to not pathologize normal behavior. So I think that that's something definitely, and I don't think it's always on purpose. I think sometimes I know for people I've seen, they're like, well, my kid's just out of control. Like, he's 2. Yeah, he throws himself on the floor and has a tantrum. You teach him the coping skills so he stops doing that. Now, if there's a problem after that.
That brings me to my next little story on this topic. So when I was younger, when I was in elementary school, my parent, I always knew that something was different about me compared to all of my peers. I never have ever been able to sit still. Ever. I'm talking first grade through grad school. Even in college, I would eventually, I developed these coping skills where in elementary, it was problematic because I was being disruptive. Whereas then I got to a place in college where I could speak up for myself, and I would tell the professor on the first day of each class, I'd be like, listen, I've got this thing where I move around a lot and it's really disruptive. And to me, I hate when people sit next to me who are moving around a lot and clicking their pen and doing whatever. So can I have a seat where it's like kind of like on the edge? Like, so at least I have, like, I basically need an aisle seat permanently, or people are going to like physically assault me for moving around so much. And in, when I was younger, I had like IEPs, like the individual education plans. And when I was younger, I didn't realize any of this. It was until I got older where then I was like going through my mom's old paperwork when she died. Like I was cleaning out her, I was like, what? I had IEPs throughout. Well, this all makes sense, you know, and I was always getting in trouble and I was always interrupting people. And I had such a hard time with homework and learning. And my parents took the position of, which to some degree, like I respect and I'm grateful for, they took the position of nothing's wrong with her. She's just Deanna.
She's just Deanna, which
She's
is
just being Deanna. And it wasn't until I was in grad school where everything kind of came to a head and I just couldn't focus. And it was not making any sense because I couldn't focus on things in my home. Things were kind of falling apart. I couldn't focus on my work. It was weird. I would be like my coping, once again, I always talked about taking baths, was taking a bath and reading a People magazine. That was like my thing back in the day. And I remember going into the bath and looking at the People magazine, and it was like the words were almost like spinning. Like I would read the same paragraph over and over and over again. And it was like, I wasn't processing it. And so obviously that's really disruptive. I was going to USC for grad school, super expensive school that I was putting myself through. And I ended up getting an evaluation to go talk to the psychiatrist. And she was super upfront with me. Like in college, a lot of people abuse prescription drugs. And so I just want to do some thorough testing and evaluation. And it took months. And it was actually quite funny because she did this very thorough, comprehensive history of my childhood. And she's like, I have a question for you. So you were never diagnosed in childhood? And I'm like, nah, I don't think so. I definitely wasn't given any type of medication. She goes, how did you make it so far, like in school? How did you make it this far being, it's like underdiagnosed. You know, there's like,
yeah,
over-diagnosing. Everyone has ADD, put everybody on medication. And then there's people that fly under the radar and don't get any type of treatment and just kind of struggle and bump around, but they somehow find their way out. And I was like, I joked with her, but it's kind of true. I'm like, well, I'm Jewish and I grew up in a Jewish family that literally talked to me about college from the moment I was born. Like my grandma has literally never given me a present. Like I'm 5 years old and I'm super into bouncy balls. Like, nope, she can't do it, but she can give my mom a check for my college fund on my 4th birthday. Which I didn't even know what college was. So
you develop coping skills based on the expectations that were put forward in your environment and you pulled it off.
Right. But it was hard. And I feel for people who come from similar backgrounds who can't manage to just get to where they need to go. Like it's unmanageable. And basically I hit that place in my life at 27 years old and ended up being diagnosed. And since I've gotten treatment, I'm still pretty weird and out there. I mean, look at how this podcast is run. I'm going from one topic to the next, but I've embraced it. And I have come to a place where I actually really like that part of my personality because I have a lot to talk about and a lot of interests. And I purposely don't put myself in a box because I'm all over the place, if that makes any sense at all.
It does. And I think what's great about your parents is that they got you the help you needed and they didn't label you with it and make it like a handicap, which I appreciate, you know, so it wasn't diagnosed, but at the same time, there were things in place to help you out.
Right.
And if you have children that you're thinking about, they're not even necessarily, you don't even have to have like an IEP, which is a special team at school. You can ask for a 504 plan if you're in California. I've had that. I've seen that with people in my family and then also with kids I've worked with where if like, for instance, if you know you have a kid that's going to miss a lot of school because of whatever, there can be these supports in place so that they just don't fall by the wayside. I think one of the things that made me think about it when you were telling the professor that, you know, you advocated for yourself, right?
Mm-hmm.
It's big for us to advocate for ourselves as adults. It's important to teach younger individuals how to advocate for themselves as well. We've seen a lot like the fidget spinners and the little fidget cubes and things like that, which became like really popular and almost obnoxious on some level recently. But
I didn't get it. I'm like, and I have the diagnosis personally. I don't know. I don't own one of those. Do you own one of them?
I have them here because I know that they're, you know, became kind of like you could buy them at every quick stop shop or whatever. But they are like in my office, I have these things because sometimes we just have nervous energy. And
Yeah,
I loved that. I loved that in some ways, some of this stuff is becoming pop culture. For instance, I don't know if you've seen, and this is if you experience any anxiety or kind of a hyperactive tendency. You don't have to have a diagnosis for this. The fidget spinners, the cubes, stress balls are a thing.
My tiny feet.
Your tiny feet, blowing bubbles.
Hands.
We talked about blowing bubbles being good for anxiety and getting your breath back into you and, you know, so you're not hyperventilating. The other thing that I love, I don't know if you've seen these, are these mermaid pillows. They're sequin, right?
Oh, yes, I have. I know all about it.
Right. And I have those in my office. And not only is it calming, but it gets rid of some of that nervous energy. So in a way, I kind of like that all of this stuff is front and center and that people have exploited it because it's worked out well for me from like a clinical perspective. Does that make sense?
Yeah, it absolutely makes sense. And these are all coping tools. Right. I talk about the tiny hands and the tiny feet. If you're just tuning in, this is
Deanna doesn't have tiny hands or tiny feet.
Yeah, I don't. I actually have really big hands and big feet, but there are these plastic tiny hands. And I don't know why they just bring humor into my life and it makes me feel I just love them. So I utilize those a lot. I haven't owned a fidget spinner, but all those like tactile things can absolutely help ease the nerves or just, it could even lighten the mood. You know, they're just like fun. Remember lava lamps?
Yes.
I could zone out on a lava lamp. Or, God, I just gave it away to Goodwill. It was this like, it's at nighttime, you turn off all the lights and it projects like twinkly lights on your, it like projects the constellations on your ceiling and it moves so slow and it has like clouds and it's beautiful.
Why did you give that away?
I gave it away.
Should have mailed that to me.
You know what? I don't know why I gave it away, to tell you the truth. I went kind of nuts with the spring cleaning. And I was doing the whole, like, if you haven't used it for 6 months, give it away. I can find it on Amazon. Maybe they'll have like a newer version. But I'm not trying to like talk against fidget spinners. So hopefully I didn't come off as being like judgmental or like bleh, like dismissive. But I guess I was just coming from a place of like, there are millions of people who own fidget spinners and each one of you don't have.
Exactly.
That's where I was going with it.
Yeah.
Fidget spinners and these like sequence pillows and tiny plastic hands are all ways to cope with life. You don't have to necessarily have a diagnosis to figure out what it is that you need to do to make yourself feel pretty awesome. I like tiny hands and bubbles personally.
And one more thing as we wrap up the ADHD thing, I think that we live in a world with a lot of nervous energy and sometimes we just need to kind of get that out, right? Because we're still just humans and human bodies. So that's kind of why we brought up some of those different coping skills.
I was going on a weird tangent a couple weeks ago where I was like, I want to move to Europe. And I was reading, I don't think we're going to move to Europe. My husband told me no, which I'm sad about. But I was reading up on, I think it was Denmark or Finland. I think it was Denmark. But they were saying, it was interesting. They were saying that in America, you tend to be bullied and teased if you're not like academically advanced. I went through that, right? Because I struggled. But in countries in Europe, the kids tend to be bullied if they are academically advanced. Like if they're trying to just do too much, like they actually get bullied and teased.
That's interesting. Man, maybe I don't want to go to Scandinavia.
Because the culture is just like doing the basic is just fine. It's totally acceptable. And in fact, like doing more so is just like, what are you doing? And it's like, God, America is just totally different.
Well, it's
so much pressure.
Certainly competitive and pressure.
Yeah.
One thing that I wanted to touch back on that you said you had to have this full extensive thing to get the medication. Stimulants used to treat someone with legit ADHD do affect the brain differently. Again, we're not doctors, but it would help you focus and basically get back to a normal, right? If you're someone who is abusing these, which people do all the time, they act like it's okay in some cases because it's a prescription drug and they're doing it to study or whatever. You do get that kind of superhuman type ability, right? Like you don't need to sleep and you don't need to you don't need to take breaks. It's because it's a stimulant.
Right.
It is affecting your brain that way. So it's interesting.
I can personally attest to that. Like my medication, I don't take it. I haven't taken it for a while, ever since I got pregnant. But when I was taking it pretty much like full time, I had to be real careful about like when I took it, because if I did, like I knew, God, I would need like a Benadryl or something to get to bed. It was really, really difficult to basically calm. It's weird. It's like I was able to calm down and focus, but I still wanted to like run 10 miles. So when it came down to just like chilling out, it was difficult for me. So it was more like PRN, like as needed.
Okay.
And if you fall into that slippery slope of like, they're drugs that my doctor prescribed me, so they must be okay. Once again, you need to be your own advocate. And so I made sure I was really, really careful about this prescription because I know it could be addicting and it could be hard on the body. So you have to realize, like, if you're going to Hawaii to chill out and sip virgin pina coladas or a full-blown pina colada, whatever, and you're going there for peace and relaxation, maybe you're prescribed it, but maybe, I can only speak for myself, I would probably forego medication that week. You get what I'm saying? Like, right. There's nothing to focus on. There's no deadlines. I don't need to do any work. I'm not reading anything other than a menu of what I want for breakfast. So I would make the personal choice not to take it. But everybody's different and you have to advocate for yourself and you need to know what's right for your body. And I'm just speaking towards the people that are like seeing negative effects of stuff like Adderall, but they just keep taking it because they're prescribed it.
Right. Well, I actually, okay, so real quick back to that. There's a reason why I've never played around with that stuff. And it's because I know I would love it. Right. And I've said that jokingly, but I also say that with 100% like self-awareness. I'm somebody who functions really high anyways for a lot of reasons. Some of them to prove to imaginary people that I have my worth.
That's another topic, another episode.
I've never touched stimulants, including one of my exes had ADHD, because I knew, oh boy, was that going to be a bad road ahead of me. And so I think it's really important to be really honest with yourself. In, sometimes I think there are people with legitimate issues that need treatment, but I think also we need to be real honest with ourselves. Speaking of,
we can do like an entire episode on that, because I'll join you in self-disclosing and being vulnerable. Like, I'm the same with opiate. I can't get near them. Thankfully, I never had like an issue. Even if I did, it's nothing to be ashamed about. But when I had shoulder surgery, I was prescribed opiates and I liked it a little too much.
Right.
So because I have neck issues and back issues and all sorts of issues that are surrounded by pain. And it took away my pain and it increased my energy. And I was really happy about it. And I found that after like 2 months of being on it, I got to a place where it was like, I don't think I need this anymore, but why did I just get it refilled? That didn't sit well with me. And I just made a decision. I don't want it anymore. And I haven't had it since, but, that was 100% personal, like will and super self-aware and not falling into the trap of going, it's fine because my doctor prescribed it.
I had to tell again, and we have to stress this over and over and over again because it's literally to cover our ass. This is our personal experience.
Right.
I was going through a period of time where I was not sleeping very well. My depression was spiked up and stress and everything. And I was given sleeping medication. I had to tell my psychiatrist, I don't want this anymore. And I had to make, I remember very clearly where I made, I had a prescription. I made poor choices though, in that I didn't want to feel anymore. I just wanted to go to sleep. So I took a pill. Mm-hmm. And after a while I was like, told myself, like, listen, Frances, you can't be using this as a poor coping skill, even if you have it. So I think it just comes back down to like being real self-aware and real honest with your motives. Mm-hmm. And you talked about that before where you got off of anxiety meds. Again, these are case by case things, but I guess the challenge is to just be aware.
And have an open communication with your provider. I can say this, Frances can say this for herself. When we were taking certain medications and said, you know what, I no longer think that this is right for me because of one reason or another, before we stopped anything, before we titrated anything, we talked to our provider first and consulted with our psychiatrist or whoever it was, our doctor, to get the okay so that we could safely do this. And that is what we will always tell everybody who comes to us.
So we want to move now to, we have a couple more we want to get to and we'll wrap up the show today, but OCD. Just because you like your house a certain way, or you like stuff in your car a certain way, or you're really particular about things, does not mean you have obsessive compulsive disorder. The end. I'm so irritated by that.
What is obsessive compulsive disorder, Frances?
OCD. And I know people listening are maybe guilty of it, or they've heard someone say, oh, I'm just OCD. No, you're not. I mean, maybe you are and you get diagnosed, but just because you like something a certain way and you're particular does not mean you have OCD. You have to have obsessions and compulsions, meaning that you have recurrent, persistent thoughts, urges, or images, and then you attempt to ignore them, but it doesn't work. So what helps out with managing those obsessive thoughts or urges is a compulsion, which is a repetitive behavior that you feel driven to perform in response to the obsession. And it could be things like counting. It could be things like, people sometimes flip lights off or check locks and things like that. It's not a fun thing. It's
completely disruptive and
it's time consuming.
Oh yeah. People are really suffering when they are in the throes of these compulsions and obsessions. Aren't these like, an example would be somebody who every time they walked through a door, so whether like going through their bathroom, going down the hall into another bedroom, every time they walk through that door, before they walk through it, they need to tap on the door handle 45 times.
Yes. It's not keeping your house a certain way. And I go back to that because people often do it when they're like, they say they're a clean freak or they have OCD. They like things filed and orderly. That's not what this is. This is time consuming. It causes problems in multiple areas of life. This is people who like wash their hands so much that the top layers of their skin are gone. Mm-hmm. These are just some examples. The tapping stuff where they can't, and you can try and tell someone with OCD, well, just stop. It's not that easy.
It's not. There's obsessions in terms of this disorder, like fear, serious fear of germs or contamination. So people will cannot hold a job. Sometimes people can't hold a job because they're in such fear of germs or contamination that they spend every waking hour, bleaching everything in their home.
Sometimes their bodies too.
Right. So obviously that's going to interfere with aspects of life such as work and school and personal relationships. How can you carry on a healthy social life or even a personal relationship with your family if every time they're walking around the house, you're following them around with bleach? You can't have a relationship.
Right.
It suffers, and everybody suffers. Families suffer who have a loved one with this. The loved one suffers. They really want out of these compulsions and obsessions. And the great part is that it's treatable.
It is. There's also, sometimes people have insight into it and some of them don't. Now there's also, I've brought this up, OCPD, which is obsessive compulsive personality disorder. And this could be something where you are obsessed with things being orderly, perfect, oftentimes at the expense of flexibility, openness, and efficiency. You're often preoccupied with details, rules, lists. My friends make fun of me because I make lists of lists. This is something that dates back to, like, I remember making a list in preschool, and it's just something that in my 30s, I just happened to ask, like, hey, by the way, like, what, because I don't need to know my diagnosis. I need to know what it is that I'm dealing with. But I happened to ask, and I was like, and she told me, my psychiatrist did, and I was like, oh, that makes sense. The thing is, you can work with it. Mm-hmm. But the reason why we want to bring this up today is the next time you or someone says something like, oh, I'm just so OCD about this, like, it's painful. There have been people that commit suicide because they just want this stuff to stop. Mm-hmm. And so to throw it around as a joke or something is just, it's not fair. It's not fair. It's not right. It's ignorant. It's insensitive.
And one more thing about the obsessive compulsive personality disorder, which is it's different from OCD, is that, just as Frances had mentioned, like, there's an overwhelming need for order. There's an unwillingness at times to yield or give responsibility to others. So these people have a hard time asking for help. Mm-hmm. Like, would you say, like, it would be difficult for somebody with obsessive compulsive personality disorder that are super orderly and very, very clean to welcome a friend or loved one to help them clean their house?
No. But you can work, but the great thing is you can work on these things and learn flexibility.
You can, but somebody, let's just, as an example, who has OCPD, the personality disorder, and they're unwilling to work, I think my not to diagnose my grandma on air, but I'm pretty sure she has this. There's an unwillingness to yield. There can be a sense of righteousness about the way that things should be done.
Okay. If you can see us on video, Deanna, I have a bad date story. And you're going, wait a second. How does Frances's bad date story fit in to talking about obsessive compulsive personality disorder? So let me take you on a little trip back a few weeks ago.
Oh, this is going to be good.
The dates had been going well. Really like the guy. No one knows who he is, so it's fine. He seemed to have, like, his life in order, a good dad, things were good. Then I sent a text message before yoga. And the plan was to meet one particular evening. And on my way into a yoga class, I was like, hey, do you want to meet here at the brewery? You can meet some of my friends and then we'll go do our thing. Thinking he's going to come into town. We'll meet. This is great. Look, this is a sign you're going to meet my friends. I put my phone down for 45 minutes of yoga and I come back to my phone, which has a bunch of text messages. And I try to clear up, like, I'm sorry, I put my phone down, but I was in yoga and whatever. I proceeded to get my ass chewed for changing the location of where we were going to meet. So much so that, like, I didn't even, like, I apologized. I said, I'm sorry. Like, I understand. I sent that text message, like, get it. But the thing was, it didn't really change the time he was going to leave. It may have changed what he was going to wear, but it turned into an absolute ass chewing about changing the location.
And not the, like, good kind of ass chewing.
You know what's funny, Deanna? he totally would have gotten laid that night.
Oh,
And
man.
so here is where, look, times have been tough.
Sorry, dude.
Here is where this self-righteous rigidness really got in the way. So it turned into an ass chewing, which then, by the way, even when trying to say like, hey, okay, it's a miscommunication. I'm sorry, my bad. The reaction was so far over the top.
Punishment didn't fit the crime.
No. I'll talk to you after you're done having a drink with your friends. And I didn't call him back. He didn't call me back. And that was 4 weeks ago.
Whatever. Your loss, pal. I mean, yeah, when people are that's a pretty good example of just like that super rigid.
Just could not give. So lesson learned. By the way, that was one that you used your picker on.
I'm so disappointed. And he was he was a front runner.
He was a front runner. The day before, it was like, I will work through your walls and boundaries, blah, 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 blah.
I was super proud of this dude that I never met. I was like, oh my God, this is going to be awesome. And then that happened. And I was like, well, I need to brush up on my helping of picking.
It turned out great though, because moving on, great. At least I saw you lose your shit over trying to meet my friends because I changed a place. Got it.
Thank you for not wasting my time and unleashing this type of fury like a year into it when you're all in love and whatever. And oh God, thanks for doing this early on.
Yeah.
Good times.
So that was the OCD, OCPD. PTSD is something we've heard a lot about. We've heard a lot about it in regards to military that is returned from service. This is also something that people experience if they're in a situation where they feel like their life is threatened, they could die, or they're in a situation where they're around someone. So PTSD can actually be diagnosed in children, even if like they're in a domestic violence relationship, or their parents are, and there's just that general feeling of being unsafe. So when people say like, oh, I have PTSD from my bad dating life, that's probably not the case.
Mm-hmm.
I do like that PTSD has become something that people are more willing to talk about, mostly because of people returning back from the military. And you think about these things that people have seen, and of course, these are terrible, horrible things. Not all people who experience trauma get PTSD, but it does include directly experiencing a traumatic event also, or witnessing. There's also experiencing repeated or extreme exposure to aversive details of a traumatic event. So, these constant triggers, there's actual reoccurrent, involuntary, intrusive, distressing memories related to it, or dreams. And then sometimes people will have flashbacks. So those are the big ones.
Right.
The other thing that we wanted to include on that is that often people will go to great efforts to avoid distressing memories, maybe external reminders. And then also there could be this hypervigilance, exaggerated startle response, problems with concentration and being irritable. And there are timelines for this. It has to be at least a month.
Okay. 4th of July is coming up, and every 4th of July, I get super angry about the people who shoot off illegal fireworks or fireworks in general at like 3:00 in the morning. And the reason for this is, one, I have a dog who hates fireworks. It scares her, and it's hard to anticipate fireworks when it's not a part of a show that it's like, oh, there's a fireworks show from 7 to 9 p.m. And it's like, okay, so for 7 to 9 p.m., I'm going to put the thunder vest on my dog and put her in the bathroom with, whatever. I'm going to give her maybe some medication. But when it's like 2 weeks out, like 2 weeks after 4th of July at 3:00 in the morning, when someone shoots off like an M80, that sounds like, my heart just exploded out of my chest. Obviously I'm still pissed about my dog now going crazy, but I always think about people with PTSD. So like people who are just trying to live their life, and sleeping can be
very hard.
Very hard. And I often think about people with PTSD who have come from war zones, or just maybe their traumatic event have to do with like, it doesn't necessarily have to do like the actual event or series of events have to do with violence. Somebody could not necessarily gone through something like that and still be easy to startle or trigger. But certainly, wouldn't it make sense that people who have come from war zones be seriously startled, who have PTSD because of an M80 being shot off at 3:00 in the morning? You know what I mean? So it's like, I have a hard time thinking, like, I talk about this stuff in hopes that, I don't know, I just like to educate the public, and hopefully the information gets out to the person that is capable or shoots off M80s in the middle of, I tend to think those people are so friggin' selfish and ignorant and stupid anyway, that even if they had heard this information, they're just so selfish that they're like, whatever, I don't care. But that's just me being jaded and cynical and pessimistic.
Or maybe sometimes people just don't realize, you know, and then
so for the sake of me being optimistic, I hope that this information can be spread to our various loved ones and friends, and then maybe somebody can hear it and be like, you know what, that makes sense, and so I won't be shooting off fireworks at 11:00 at night. Like, let's just respect the time frame.
Right.
So people can anticipate it. Like, we're not trying to be party poopers. I'm not saying on 4th of July, no fireworks. I love fireworks and twinkly lights, but I also like knowing when to anticipate fireworks. That's all. Stop being dicks with your loud booms. Dude, somebody shot off a M80 a couple nights ago. Remember I said a few episodes back, there's been like unsavory characters. Well, guess what? My neighborhood watch sign is up and I've got all sorts of stuff happening. I'm so proud of my neighborhood. We really have like organized a lot, and the like break-ins and the characters have decreased. But some little jack off shot off an M80 in the porta potty.
Oh, yeah.
And I'm mad. So now I'm back to the idea of shoving my Rottweiler's shit in bags. And
don't do that.
I know.
One
it's
thing
so conflicting.
One thing I wanted to mention is that we can think of the easy things like the loud sounds and stuff, and like car wrecks and screaming and yelling might be something that triggers people. But also and here's a great example of how I had to really check myself. And I'm a mental health professional and I miss this. There was a time where me and you love dogs.
Yeah.
Okay. If there was a time I was with a client where this particular dog we were on a mindfulness walk, right? Like we were trying to do something to encourage mind-body connection and all these things. It's a beautiful day. We see these cute little dogs. These people it sent her into a full-blown flashback. And I had no idea what was going on. I got her to be able to talk about it.
Oh, wow.
Then the same thing happened where she went to go see her individual therapist, and the therapist brought her dog with her because there was something going on. The dog needed to go. This therapist was not being mean. They didn't know. Client walks in, the dog triggers her because of this post-traumatic stress disorder. Mm-hmm. So to just be not overly sensitive, but to just be aware that sometimes we just don't know what's going on in people. And also, you know, there is sometimes just a healthy adjustment time for if you have an experience that is negative, that you might have some, you know, like just some time to kind of readjust, right? To find your new bearing. And that's okay. And that's normal. And that's just life. But if it gets into the place where it is causing significant problems and the things like we said about PTSD, then that's something different. And we definitely recommend you get help. As we're wrapping up, I do want to say, we said we'd leave you with something with a laugh. And that's when people, have you ever said you're antisocial?
I you know what, I'll admit it. I've said I've been antisocial before, right? Because I don't want to go to a party.
Right. And so, okay. So what's the,
I hear that a lot.
Where have you heard it? Okay.
On Instagram, there's like all the time, like quotes and memes and stuff, like talking about being antisocial. And it shows like a picture, like, you know, the meme says something like, oh, my friends invited me out to a party. And then I told them, you know, I'm busy doing something important, but really I'm antisocial. And it's like a picture of somebody in bed eating popcorn and like petting their dog. And I'm like, Oh, in the context of antisocial personality disorder, that certainly doesn't make sense.
Yeah. So the next time you want to use the excuse of I'm antisocial to get out of a social event, and you're listening to two people who do that, well, we try to get out of social events on a regular basis.
All the time.
Let us leave you with this bit as we've been trying to clear up some misuse of diagnosis. A person who has antisocial personality disorder has a pervasive pattern of disregard for and violation of the rights of others. Since about age 15, they've done some of the following: failure to conform to social norms with respect to lawful behaviors, deceitfulness, lying, using aliases, conning others for personal profit or pleasure. By the way, think about this the next time you say you're antisocial to get out of something. Impulsivity or failure to plan ahead, irritability or aggressiveness, indicated by repeated physical fights or assaults.
A lot of times people who have antisocial personality disorder, oftentimes they can also have narcissistic personality disorder, are people that we find who are abusers in domestic violence situations.
Right.
One of the psychiatrists I worked with said people typically who have antisocial personality disorder have no loyalties to anybody, not a single soul, only to themselves. So if they are acting nice to you, it's out of manipulation to get whatever it is that they're after. And if you don't give it to them, then it could end poorly.
Yeah. There's a reckless disregard for safety of their self or others, inconsistent responsibility, and lack of remorse is the big thing, inability to experience true empathy. Not that all people with antisocial personality disorders are criminals, but you could probably see a lot of these traits in people
in jail,
that
prison.
are like in like real jail.
Prison, not just like, yeah.
Yeah. So the next time you want to get out of hanging out at brunch with Sandra, who you can't stand because she's going to talk about her perfect kids in her Pinterest house,
just know that you're normal. No one wants to hang out with Sandra.
It's not because you are certifiably antisocial.
Yeah. So. You are social. You're just being socially avoidant.
That's fine.
Somewhat like us.
Sometimes you just don't want to do it.
It's called self-care, So I don't know. I guess we could pick it apart and I don't know, antisocial. Just look up antisocial personality disorder and just read up on it and see the famous criminals who have been. Yeah. Look up antisocial personality disorders, forensic psychiatry in a Google.
It's fascinating. There's all kinds of really interesting stuff on it. So anyway, we wanted to, and we know that this was a pretty clinical podcast, but hopefully you got something from it. And again, if this is not to replace actual help from your treatment team, so please.
Can't say that enough.
I know. Mother your ass. Anyway, what was your self-care like this week?
Okay. I have noticed something that sometimes a lot of times I have to have somebody initiate. I was like, I want to do something different than just Babs. So I almost said roommate, my neighbor, she texted me and a few other neighbors and was like, I need to get my nails done so bad. Does anybody want to go? And I was having a socially avoidant moment of like, I don't want to leave my house. And then I was like, no, I need to get up and go. I really like this neighbor. It'll give me an opportunity to hang out with her without our kids hanging off of us and our husbands and whatever. So I went and I had a really nice time.
Awesome.
So I told my husband, you got to take the baby and I'm going to go get my nails done and my toes done. And then I'm so annoying. I got a gel manicure, because those
that's what I get.
typically don't chip. Well, I was not pleased with the work because one of my nails started to chip 2 days afterwards. And I'm one of those people, it's like, it's over. So now I have to peel it off and then look at my nails. It's not there.
See, that's funny you say that because mine were done 3 or 4 weeks now. And my lady Diane is amazing.
I need to go to Diane. I'm looking for a different spot.
My Peeps nails for Easter are a little past dated. So I need to take care of that.
That is so cute. I love it. What did you do for self-care?
Well, you know what I wanted to do was to talk about, for me, was pushing my comfort zone a little bit. And this was self-care in that I was able to connect with friends. My birthday was a couple of weeks ago. And I decided to invite everybody over, which typically makes me very uncomfortable because I don't like people at my house. But I was like, Frances, you spend money every month paying for your house. You should maybe have friends over. And
great point.
My self-care was that I allowed some of my friends to help out with it because I'm always trying to make sure everything is great and everybody's happy and all that. And my friends came through. Man, do I have some amazing friends. So
Awesome.
I let them help out, which was huge.
I'm proud of you. You deserve it. We love hanging out with you, and you have a wonderful home.
And they cleaned up afterwards. They helped me clean up, which just felt amazing.
Awesome. Good.
I wanted to share this little bit of this message I got from a listener shout out. She says, I have to thank you. The boys and I listened to you and Deanna all the way back from Tucson to Fresno, which is quite a drive. You saved my sanity. You saved my sanity. She said, I loved the tired teacher talk because she's a teacher. And talking about attachment was great. My brother and I have those combos a lot.
Cool. That's awesome. Thank you for that. I wanted to show that I got this interesting fan mail. Check this out. Okay. One of my followers named Brett, she lives in Canada. And this is a Canadian magazine. She sent me, they're the same exact magazine.
Okay.
Like, look, I'm showing Frances on the video, same exact thing, except it says men pay $8.81 for this magazine and women pay $6.99 for this magazine. And so they said, we've made 2 covers with different prices, one for women, the issue you're holding, and one for men. The prices reflect the shocking 26%, 26, that's weird. It says percent pay equity gap that still exists in Canada. The content is exactly the same, just like the work that men and women do. Interesting.
I like that. That's interesting. And you know what? I think that kind of falls into a feel-good thing in terms of raising awareness for it.
Right? I like that. So, you know what? Let's go with that. I like the feel-good that we're living in a time where magazine publishers are putting out information like that. I think that's pretty powerful. It's one thing just to see it. It's another thing, at least for me, like to hold it. Right. And see it. And it just makes a really big statement. Lastly, in Denver, after Denver hired homeless people to perform day labor for the city, more than 100 of them landed regular jobs. We hear stuff like this all the time, but what I wanted to point out is that I really liked this. It was the Denver Day Works program, which launched in November 1st of 2016. They paid them a wage to perform up to like 3 to 6 hour shifts. They let them do it even if residents lacked like identification. Oftentimes when I worked with homeless individuals, there's all these barricades that they have to get through. Like they need their birth certificate. They need a proper identification. Like sometimes I would like jimmy rig and identify, like I'd give them like a sticker from the hospital and like I would take a picture of them and be like, here's your new ID while you wait. And they'd be like, sorry, no, we need an official ID card and a birth certificate. What? I don't even know if I own my own birth certificate. And I'm
lots of systemic barriers.
Yes, lots. And so I bring this good news story up because it sounds like they launched this program. Like there says no background checks were required. Persons who lacked identification were given supplementary help so that they were given the same experience. So that's why this story felt a little bit different to me rather than like all the other stories we hear about, which while they're good and positive things, a lot of people are still left out because of the systemic barriers that exist.
And I think that's important to bring up is that if we want to see change in things like, you always hear that argument, why don't they just get a job? Well, sometimes there are things in the way that we don't think about. And something as simple as identification is one of them. So I love that story. Well done, Denver. Well done.
Awesome.
All right. So that wraps it up for us.
Thanks, guys. Saw a lot of reviews on iTunes, and we're currently sitting in the 100 spot on the top 200 charts for the health category. So I'm hoping that we can keep that up with the support of all of our listeners. Please don't forget to subscribe. Like I always say, have no shame and go around your neighborhood and grab people's phones and subscribe on their phones. I'm totally kidding, but not really.
Not really.
review us, leave a 5-star review, all of that stuff. You can find me, Deanna, at Hilarious Humanitarian on Instagram. You can follow our Instagram page, Humanitarians Podcast on Instagram. Frances is at Shut Up Skippy. What's your Snapchat?
Shut Up Skippy, which is
Okay.
fun. I love Snapchat too.
I need to get on that. I'm not great. If you guys want to send us fan mail, you can. The P.O. Box address is on the description. You can find us on iTunes, Google Play, YouTube, Stitcher, TuneIn, and I'm looking at our analytics, and apparently you can also find us on like 300 other outlets. So I think our podcast just kind of like is living in like all the different applications, which is a great thing.
Fantastic. Spread the love. All right. Well, we will talk to you next week. Bye.
All right. Bye, guys.